Namaste friends, this is Dr. Raghuram. Welcome to Easy Ayurveda, the first episode of SomeHITA from SAMHITA. So today's reference about which I'll be speaking in this video will be from my favorite, and I also think that it will be favorite for many Ayurveda students, doctors, practitioners, everybody. Charaka SAMHITA. Here is our Easy Ayurveda Charaka SAMHITA Volume 1. So we have all 4 volumes of Charaka SAMHITA, friends. Down there in the description you can find the links to purchase Easy Ayurveda Charaka SAMHITA, made easy for reading and understanding for you all. Now coming to today's reference in SomeHITA from SAMHITA, I'll be telling you about the futures of Sukha Sadhya Vyadhi. We know that there is a classification of diseases into many types. Sukha Sadhya Vyadhi. The terms itself indicate that Sukha is easy, Sadhya possible, Vyadhi diseases which are easily curable or easily possible to cure. So a physician and also a student of Ayurveda should necessarily know about what are the futures of a disease which is Sukha Sadhya, in what conditions a disease would become Sukha Sadhya or easy to cure. Now we'll see what Master Charaka has to tell about this. The reference for futures of easily curable disease is available in the 10th chapter of Charaka SAMHITA Sutra Sthana. This chapter has been named as Mahachatushpada Adhyaya. Now let us straight away come to the futures of a Sukha Sadhya Vyadhi. So friends, Master Charaka tells, when a disease presents these features or satisfies these conditions, it will be easily curable. What are they? Let us see one by one. Hetavaha pura rupani alpani yasya cha. So that is the first line. What is it? Hetavaha, alpa hetus. When there are less causative factors of a disease. We know a disease is caused by various causative factors. The lesser the number of causative factors or etiological factors, the easier it is to treat a disease. So a disease graduates to be called as easily curable disease when it is caused by few or fewer causative factors. Alpa hetavaha. Then alpa purva rupani. Purva rupa means those symptoms which appear just before the manifestation of a main disease. Premonitory symptoms or prodromal symptoms, we call them as. These are the symptoms which suggest that a disease will be formed in future. So when there are few purva rupas, very few purva rupas for any disease, that disease will be considered as easily curable. Alpa rupani, a disease which has very less symptoms. A disease having very less symptoms is easily curable. Nacha tulya guno dushyo. So we know that friends, any disease will be caused by the vicious combination of doshas and dushyas. Dushyas include the dhatus and also the malas. So they will be having their own characteristic features. Like doshas will have their gunas, qualities, and the dushyas also will have their own qualities, gunas. So a combination of dosha and dusha, dosha samurjana, is causing disease. Here the condition is, a disease will be considered as easily curable when the qualities of dosha and dusha are not similar. The qualities of dosha and dusha should not be similar. To understand this, we need to understand the ashraya ashrayi bhava. Like the doshas are present in some dhatus. Particular dosha like vata is present in asti, that is bones. Pitta is present in rakta, that is blood. And kapha is present in mamsa or meda, that is muscles or fat. This relationship we should know between dosha and dusha to know whether they are similar in characters or opposite in characters. Let us take, for example, vata is located in asti, tatrasno vayuhu. Vayu and asti will have similar attributes. When vata increases in asti and produces a disease there, it becomes very difficult to cure. But on the other hand, if vata produces a disease in mamsa or meda, that is muscle or fat, which are the abodes or the residences of kapha, here vata, the causative dosha, and the dhatus, that is mamsa or meda, will have different qualities because mamsa and meda belong to kapha dosha. They are the kapha ashrayas. Next condition is na doshaha prakrutir bhavet. So what does that mean? We all have body types. If my body type is vata, I belong to vata prakriti. So the dosha which is forming my prakriti should not be similar to the dosha which is causing the disease. For example, a vata prakriti person getting a vata disorder, it is difficult to treat. Why? See the logic here. Because the person's prakriti is vata and it is having a similar nature of the disease causing dosha which is also vata. So that is why it is difficult. Now take the other part of the example. If a vata disorder occurs in a kapha prakriti person, here the nature of the dosha which is making the prakriti of a person, that is kapha, and the nature of dosha which is causing the disease, that is vata, are contrasting, opposite in nature. That is why it becomes easily curable. Nacha kala gunaha tulyo is the next condition. The season in which the disease has been manifested and the qualities of the disease or the disease causing dosha should not be similar. For example, a kaphaja roga, a kapha disorder which is manifesting in Vasanta Rutu may be difficult to cure because Vasanta Rutu or spring season is a season for kapha aggravation. Whereas the same kapha disease becomes easily curable in the next season, that is Grishma Rutu, that is summer season. The qualities of summer season are opposite to those of kapha and the kapha disorders. That is why the diseases are easily curable. Nadesho durupakramaha. The patient should not be living in a place where it is difficult to treat that condition. So the habitat, the living place should be comfortable for treating. And similarly, when it is desha, it is also the site of manifestation of the disease in the body. That also should be such a place of the body which can be treated comfortably. Gati Rekha is the next condition. What does that mean? The disease should have a single direction of manifestation or single pathway in which the disease manifests. For example, let us take the disease can manifest in the Urdhvagati, in the upward direction, Adhogati, downward direction, Tiryagati, sidewards, everywhere. So if the disease is manifesting in all the directions, like for example, if the person is having bleeding through vomiting, bleeding through the motions and bleeding in the skin, or if the person is having severe episodes of vomiting and diarrhea simultaneously which cannot be controlled, it becomes a difficult scenario. So the disease should be moving in a single direction or a single pathway. Navatvam is the next condition. Newly manifested fresh disease. It has just manifested few days ago. It is very to cure. That means to tell that the chronic diseases which are staying from pretty long time are difficult to cure. The newly manifested diseases are easily curable. Rogasya upadravo nacha is the next condition. The disease should not be associated with any complications. Only then it is easily curable. Doshascha ekaha. Yes, next condition is the disease should be caused by only single dosha, not combination of 2 or 3 doshas. Dehaha sarvaushadha kshamaha is the next condition. The body of the person should be tolerable to different medications and therapies. The tolerance capacity of the patient should be good. Only then the disease will be curable easily. He or she needs to tolerate all sorts of medications and therapies. Chatushpadopapattischa. There should be proper and on-time availability of all the 4 limbs of treatment with their very good qualities. Bishak, the physician who is treating, or the health provider. Atura or Rogi, the patient, the health seeker. Dravya, the medicine. And 4th one, Upastata, that is the caretakers at home, maybe family and friends, or the nursing staff at hospital. All these padas or limbs should be available at a time, and all 4 components should be adorned with utmost good qualities. Only then the treatment will be easy and the diseases will be easily curable. So friends, Master Charaka has enlisted the conditions wherein a disease can be called and considered as easily curable, and that becomes easy job for a doctor to go ahead and treat those diseases. This also becomes an important part of screening the diseases and taking the cases according to one's understanding and capacity. So thanks for listening. If you loved this video, kindly like, share and subscribe to our channel and keep following us. Hope you loved the first part of the new series, SomeHITA from SAMHITAs. Thank you and namaste until we meet in the next episode, the second episode, with yet another reference and its detailed discussion. Thank you and lot of love from Easy Ayurveda.